guys, welcome back. Sum's Beauty here with another video. So today I had my follow-up with Dr. Kaufman. It was supposed to be at 10:30 this morning, but I didn't get word of it until this morning because yesterday when I got here I just fell asleep for hours. So I was going to try to reschedule it, but he needed to see me today because he was going on vacation. So my husband was kind enough to drive me over there at the last minute and rearrange his schedule for me, which I really do appreciate. Excuse me. Especially with us just coming home yesterday. So, and then having to turn right back around this morning to go back over there. I was going to record my video, my appointment, but everything kind of happened so fast that I didn't have enough time, so I'm just going to tell y'all what happened. So we get there and they take off my bandages up here on my neck and like where my sutures were, the 3 little incisions, and then they took off the clear wrap stuff for the little port thing I have. So up here it looks really swollen and nasty. They were saying that if it gets any bigger, to let them know. Don't wait till next Wednesday because I have to go back next Wednesday to see the other surgeon who did surgery up here. So they were saying don't wait. If it get any bigger, just call because I might need to be on like a different antibiotic. They took the little steri strips off of the other 3 little incisions I have, so they're just gonna heal on their own or whatever the case may be. And then as far as my port, they just changed the dressing because when they initially took it off I was still bleeding, so that was gross. But anyway, well, when Dr. Kaufman came in, he was very excited because he said that when they stimulated my diaphragm during surgery, it really contracted, meaning that the nerve transplant, the phrenic nerve transplant I had last year, that nerve is really like regenerating itself. So that was a plus because I have had a paralyzed diaphragm since 2014 and it's been sold down since then. And you guys know last year, like around February, not last year, this year, sorry, around February, my plication came undone. So, you know, my diaphragm is stuck in up position. But yeah, he said that, you know, he really saw that my diaphragm contracted, which is really good because they really didn't expect it to contract that much, being until I haven't used it in years. So he's very optimistic about the future, and hopefully, you know, within a couple months, I could try to like see if I can breathe on my own without the oxygen. So I will have to get a pulse ox just to keep, you know, check on my oxygen level to make sure like I don't pass out or something. And as far as the pacing system, he was just like, take your time. Like, don't try to rush it because it's like you can overwork your diaphragm knowing that, you know, it hasn't been working for years. So he just wanted us to be mindful of that. So again, this week I'm only doing an hour on twice a day, once in the morning, once at night. And then next week I could either do an hour and a half on or 2 hours 2 times a day. But he said maybe by January, I could be pacing, you know, the majority of my day, meaning I could be off oxygen if, you know, it helps me do that. So I'm excited about that. I'm really tired. I am starting to have some discomfort, like where my incisions are. Just like, you know, coughing and bending, but I guess that's the medication kind of like wearing out of my system. But I've already been on here for 4 minutes, so... And my husband is watching the game. He was kind enough to let me go ahead and record and not interfere in his football time. So I'm going to let him finish watching his game, and I will see you guys in the next video. Again, if no one told you that you're enough today, you are just the way you are with no strings attached. And if no one told you that they love you today, I do. So until next time, guys, peace, love, and blessings. Until the next one.